Well, we are going to talk about the pathogenesis and diagnosis of the growth hormone deficiency in adults. First, we have the methods of this study. The method consists in that we lay 352 patients who had acute major bleeding within 18 hours after administration of a factor 10A inhibitor. The patient received a boost of andexanet followed by 2 hours infusion. Then this method was divided in 4 steps. First was studied the segment oversight. This was a multicenter prospective open-label single-group study. The Population Health Research Institute, PHR, at McMaster University at the industry-sponsored Portola Pharmaceutical jointly designed the study and both select sites and supervise monitoring. The protocol, consent forms, and ancillary materials were approved by institutional reviews. Then the next step was the study population. This consists in the patients were controlled at 63 centers in North America and Europe. Patients were eligible if they were at least 18 years of age, persecuted with acute major bleeding, and I had received within 18 hours one of following apixaban, rivaroxaban. Then we have the study procedures and data collection that it was labeled concerning patients receiving andexanet boosts over a period of 15 to 30 minutes. The drug following the dose were used in the initial protocol for all the patients who had received apixaban and those who had received rivaroxaban more than 7 hours before the boost administration. Then we have the next step that was the study outcomes. The study outcomes consists that has two primary efficacy outcomes: the percent change from baseline anti-factor 10A inhibitor after andexanet treatment and the percentage of patients with an excellent or good hemostatic efficacy 12 hours after the andexanet infusion. Then we have the results. The results were that the patient had a mean of 77 years and most had substantial cardiovascular disease. Bleeding was predominantly intracranial in 227 patients, or gastrointestinal in 90 patients. In patients that received apixaban, the median anti-factor 10A inhibitor activity decreased from 149.7 milligrams per milliliter at baseline to 11.1 milligrams per milliliter after the andexanet boost. Then we have the results in 3 steps. The patients, we will later 352 patients from April 2015 through May 2018, including the 767 patients reported previously. All the patients received andexanet were followed for at least 30 days until that patients had a mean year, age, battling medical history, including myocardial infarction in 48 patients. The next step was the anti-factor 10A activity in the efficacy population among the 132 patients who were receiving apixaban. The median value for anti-factor 10A activity was reduced from 149.7 milligrams per milliliter at baseline to 11.1 milligrams per milliliter at the end of the bolus administration, at 92% reduction to 95% confidence intervals. Then we have the next step that was and the final thing, that is the hemostatic efficacy of the 254 patients. The efficacy analysis, 249 could be evaluated for hemostatic efficacy and 204 were adjudicated as having excellent or good hemostatic efficacy at 12 hours. Finally, we have the conclusions. The conclusions was that the patient with an acute major bleeding associated with the use of factor 10A inhibitor treatment with andexanet markedly reduced anti-factor 10A activity at 82% of patients had excellent or good hemostatic efficacy at 12 hours as adjudicated according to this. And then we have the videos that are for more comprehension of the topic.
Factor Xa inhibitors such as apixaban and rivaroxaban are convenient to take but can cause bleeding complications. Many physicians hesitate to use them because there's no easy way to reverse the effects of treatment in the event of an accident, internal bleeding, or a surgical emergency. Andexanet is a fragment of Factor Xa that was designed to rapidly reverse the anticoagulant effects of these inhibitors by preventing their binding to authentic Factor Xa. To test the efficacy of Andexanet, a small phase 3 trial was designed with healthy older volunteers as the participants. They were given either 10 milligrams of apixaban or 20 milligrams of rivaroxaban daily until steady-state anticoagulation had been achieved. Then intravenous Andexanet was given to The authors conclude that Andexanet reversed the anticoagulant activity of